Inflammation impacts everything from your energy to your mental health, even if you can't see it. The good news, though, is that you can fight back. So in our monthly dose series here with Dr. Charles, we'll be covering topics of hidden inflammation with health experts and wellness experts, as well as covering topics like the gut-brain axis and the impact of stressors on our modern life. Today, for our very first episode, I'm joined by Dr. Charles Akle, the Chief Medical Officer of immy, as well as Alex Kent, President of immy. Welcome, guys.
Hi, thank you.
Really
Thank you.
excited to kick things off today. So I want to know more about immy and why is it important now more than ever?
Well, we live in a very difficult world, don't we? We live in concrete jungles. We've lost so much contact with nature and our environment, and we need something to replace that. And the relationship with our environment is so important for all sorts of reasons which we can discuss, but immy replaces that loss, and that's why it's important.
Amazing.
So what's changed and why now?
So in modern life, we now live in an artificial environment. We're like living in fish bowls. We live in concrete jungles. We eat food that has been processed and is handed to us on a plate. We don't do any exercise. We don't move about. We don't use our brains. We've become lazy, and it's absolutely essential that we try and get a grip and get our acts together so that we eat better, we live better, everybody wants to live a long life. And maybe we're living a long life, but actually it's not much of a life that we're living. And if you're going to end up getting Alzheimer's or cancer or whatever it is and dying from it, what's the point? Yeah.
You know, this topic of over-sterilization is very new to me. I've just been a hand sanitizer girl. I go to airports, clean my hands, wash them. Why is it a bad thing to be over-sterilized?
Well, there's over-sterilized and over-sterilized. I mean, obviously, if you've been handling something that is likely to be toxic, then probably a good idea to wash your hands and sterilize them. So if you've been picking up dog poo or whatever it is, then I don't suggest that you do anything other than clean yourself. But it's this obsession that every housewife now cleans the floor, cleans everything so that it is spotless and shiny. And actually, you're guilted into doing it. You know, if you don't do it, there's obviously something wrong. You're a bad mother. You haven't. And what we need to do is to let people get down and dirty a little bit, particularly the kids, particularly to have pets around that tolerate them, and to let the kids go and play in the garden, go and play in the forest, roll around in the mud, and it makes a huge difference, particularly to the kids, and then on for adults.
Yeah, they always say they don't make them like you used to. So truly, the kids are not like they used to be. We used to play in the sandbox, get exposure to dirt. Now we are in these over-sterilized, hand sanitizer or alcohol cleansed playgrounds, and that's not actually great for us.
No, and if you go to parts of Scandinavia, they are so serious about getting their kids sorted out and their immune systems up to scratch that they take forest material and they spread it all over their concrete playgrounds. In fact, they don't have concrete playgrounds anymore, but this forest material is there, and the kids are playing among the leaves and the wood and everything, and those kids are much healthier, they're much less stressed, they don't get asthma, they're far happier, healthier kids. So we need to take a lesson from the Scandinavians, I think.
So the biodiversity or the diversity that they're encountering, that exposure is critical to having a strong immune system?
Absolutely vital. Diversity is the secret. The more variety you have, the more you're exposed to, the stronger you become.
And how does immy introduce diversity into our microbiome?
Well, in itself, it doesn't. But immy is one of those critical environmental agents that we've lost touch with as we've evolved over the last 2-3 million years. Immy is found in at least 30% of the world's soil and mud and water. So it's been around a long time, and there are sisters and cousins to immy elsewhere which are probably almost as effective. So that contact was a very important one in terms of tuning our immune system, because what it did was it triggered a response in our immune system which was not a threat, but which induced, if you like, a training of the muscle. You know, the old story of use it or lose it. So by triggering an immune response, it strengthened it. There are other things that do it, and we've discussed, for example, parasites like worms and helminths of one sort or another, which are probably not such a great idea. But interestingly, we overtreat those too. We overworm our dogs, and they get asthma and eczema. The same has happened to children. There are big studies that do that. And we also have exposure to illnesses. A lot of times we get exposed to illnesses. That makes our immune system stronger. So provided it doesn't kill us, then it makes us stronger. The great thing about immy is that it makes you stronger, but it's not going to kill you.
I love that. So I love the idea that we can be stepping up our game for our immune system. How exactly does immy work?
Well, obviously, we've been working on immy and its sisters for a long time. We've spent, one directly or indirectly, over $100 million trying to understand immy. So unlike a lot of the other people who are selling supplements out there, we've got some really serious science in what we're doing.
Serious science is good.
Yeah, and clinical. We've got clinical data in cancer and tuberculosis. So, you know, we have some fairly hefty data behind us. And, you know, the way it works, we now know in detail how the organism affects human immune cells. I hate operating or dealing or training on mice and rats and things because A, it's cruel, and B, it doesn't always translate to humans. But the latest data we have uses the latest scientific data, which is called single-cell transcriptome studies. And this information has been throwing up 60,000 data points per cell that we've looked at. So that is giving us an enormous amount of information as to how it works, and we're still trawling through all of that. So ask me in a few weeks' time, and I'll be able to give you a bit more information. But 60,000 data points blows my mind.
Absolutely.
And it's going to take a bit of time to work it out.
Yeah.
So as we think about immy and sort of describing how it works, we often use the orchestra and conductor analogy. Could you talk to us a little bit about that?
Yeah, so the technical names, which are always a mouthful, even worse than the full name of immy, is that it's an immunomodulator and an immunoadjuvant. And what does that mean? So an immunoadjuvant is really a kind of biological catalyst. It's a broker. It's, if you like, an orchestrator, which makes things happen. So and this was really derived from vaccines, when you try and make a vaccine against something, if you don't have a good adjuvant, an immunoadjuvant, the vaccine won't work. Yeah. And that's why we've struggled over the years trying to get a good vaccine for flu or for COVID or malaria. We've managed to get vaccines for tetanus and all sorts of other things, but it's been really difficult because we haven't found the right adjuvant. The great thing about immy is it's a terrific adjuvant. It's a great broker. It's a great interface between what needs to happen and what does happen in the immune system.
Do you mind telling us what an immunoadjuvant is for the people back home?
Yeah, sure. It's a big name for a broker. So probably the simplest way of understanding it is just about everybody's had their kid or themselves vaccinated against tetanus toxoid, which is really important. And the idea has always been that if you give a bit of something bad, the immune system responds. And when a lot of bad comes along, the immune system deals with it, right? It's very straightforward. Unfortunately, if you just give a baby tetanus toxoid, 96% of the time, nothing happens because you need an adjuvant. You have to mix it with something that triggers the immune response to recognize that there's something going on. In tetanus toxoid, we use aluminium, and you absorb the toxoid onto aluminium. It produces a reaction. The immune cells come like dogs to bell being rung, say, hey, what's going on? And then you get a response. And even then you have to give it 2 or 3 times before you get the full value. Mm-hmm. So if you like, immy is very similar to that alum, except it works better on innate immunity, which is not necessarily toxin. Things like tetanus toxoid, but cellular immunity. So it's much more powerful, much more effective, much more focused. And it's a really good broker to make sure the immune system works properly. That's it.
So immy overall is all around lowering inflammation, though. That's sort of what we're trying to tackle at its root. Can you talk to us about how does it work in even having that effect?
Well, the thing about immy is that it has an intelligent effect on the immune system to bring it back to a mean. So that's the component that we would call the immunomodulator. Yeah. So what it does is it retunes the system, and our logo is retune the immune. So it does what it says on the box. It tunes the immune system. So if it's tipped one way, it settles it. If it's tipped the other way, it adjusts it. And we've demonstrated this in scientific and models and research that we've done. So that's the beauty of immy. By stabilizing the immune system, pushing it back into a stable situation, the general idea is that it then reduces the effect of chronic inflammation. And to explain that fully, I need to explain to you what inflammation is.
Yes.
Right?
Yeah, please. Go.
So everybody talks about inflammation, but very few people really know what it means. Inflammation is the response of the body to any kind of threat or to a reconstructive event. So if you cut yourself, you will get an immune response that induces inflammation, which then induces a healing process. And it'll all be red and angry, and lots of immune cells come in, lots of energy is subsumed, but eventually everything will heal and it all settles down. Another role of inflammation is to prevent attack by bacteria or viruses or anything else that's trying to get into you. It will defend and destroy them. It also helps to look after your own body so that if you've got bad cells in your body that have been corrupted, it gets rid of them. And if it doesn't, what then happens is you get cancer. And if you get chronic inflammation, that is a big plus for the development of something like a cancer or for an autoimmune disorder, whether it's arthritis or ankylosing spondylitis, all these other things, Crohn's disease, ulcerative colitis. There are many, many, many forms of disease that are a result of chronic inflammation. In your hand, if your injury hasn't healed properly and it continues to fester, that's chronic inflammation. It doesn't settle because maybe there's an infection or a cancer has settled in there. The same with when you try to fight a bug. So chronic inflammation is the real bugbear. That is the bad guy that we need to kill and deal with. And acute inflammation, as I said, is excellent. It's good for you. It's part of, what keeps you alive. It's got a beginning, a middle, and an end, and it all settles down, all goes away. Chronic inflammation is that house guest who never goes away and he can't let you get to sleep. I mean, he's a real pain.
The bugger that won't leave, huh?
Yeah, and it goes on and on and on and on. And the great thing about immy is it has this ability to restore the function back to normal in just about every avenue that we've tested it.
That's so significant because there are a lot of supplements on the market that are purporting or claiming to solve inflammation. So I'm curious how immy is different.
Well, try spending $100 million on the research, right?
Yeah.
And you'll have a better idea. A lot of those supplements make claims that have very, very little support in science. Mm-hmm. They're based on experience. And listen, that's not a bad thing. Observational studies which have been made in some cases over centuries. Ayurvedic medicine. Right. In India has always been a great source, if you like, of some of these supplements. Now, when I was in clinical and surgical practice, I used to treat a lot of patients from Ayurvedic practitioners, and they were great because they were very efficient, very effective. The diagnosis was good, but they knew their limitations, and if there was something that needed structural repair, proper surgical repair, they sent it to me. Mm-hmm. So they didn't try and treat cancer with using some kind of herb or supplement because it didn't work.
So we're talking another level. We're talking about a really powerful agent that can help support the immune system.
Exactly. This is a really well-studied, powerful agent. It happens to be natural, which is great, and we love that. And in fact, if you think about it, almost every modern drug that we've come across has been based on some kind of natural substance. Going for it's wonderful. There's the wonderful healing thing of that was published recently and got to Nature of an orangutan Did you hear about this? So this orangutan got involved in a fight with another orangutan, and he had a big cut on his cheek. And this orangutan, started to fester. And what they noticed is he went and he picked out certain specific leaves in the jungle near him, leaves that he would never eat. And he chewed them up and he put the paste onto yes.
No.
And it healed. And it's the first case that's been described of an animal treating itself and healing. And I find that that tells you everything you need to know. How did that orangutan know that those leaves were going to help? And that was trial and error, right? So, and it healed. A big ulcer, and it healed. You can look it up. It's fantastic.
I'm going to go out into my local forest immediately.
There you go. But you better
pick some leaves.
Well, you better pick the right leaves. That's why you got to pick immy. You got to pick an immy-based leaf. You don't pick some other leaf.
Maybe an immy leaf.
Right?
Exactly.
You don't need that.
No, maybe not any leaf, but...
So we talk about it being natural, and we just talked about natural ingredients out there with this orangutan story. So let's talk about the ingredients that's actually in immy. Let's go up a level here. So it's 3 ingredients.
Yeah, just about. Yeah, so there's the immy, which is a tiny amount of heat-killed bacteria. We heat-kill it really just to shut the regulators up. Because it's totally harmless. That's why it's called the Mycolysibacter. But you know what regulators are like. You got to keep them happy. So we heat kill it because then there's absolutely no question of being able to replicate, which is quite good business news because nobody else can pinch our bacterium because it's very special to us.
Does it matter if the bacteria is dead or alive?
No, it doesn't seem to matter so much.
It still
works. It's still intact. And the reason for that is it has the thickest cell wall in nature. Mycolysibacteria have the thickest cell wall in nature. It's like a tractor tire. If you try and puncture a tractor tire, it's still there. Mm-hmm. You take a child's balloon and you put a needle in, and it bursts. And that's
resilient,
bacteria.
In and out, huh?
Yeah. So it's pretty indestructible. It's quite difficult to culture. You've got to know what you're doing. But anyway, so there's a little bit of heat-killed mycobacterium, which is all you need to get this response. It's phenomenal how little you need because the body is tuned to detect minute amounts of this bacteria. That's why it's so effective. We have olive oil and we have extra virgin, the best olive oil money can buy, because that helps to keep it in suspension. And what improves that still is by putting a little bit of beeswax in it. So that's why we can't claim that we're a complete vegan product because of the beeswax. And again, that's another regulatory thing. And I suspect if you talk to most vegans, they're not going to get too upset with a tiny bit of beeswax. The bees don't seem to mind. And then there's a gel capsule, which makes it very easy to swallow and preserve the material. And that's it. And by the way, the olive oil has its own benefit in that we know that if you drink more than a teaspoon of olive oil a day, you actually live longer. So that's part of your Mediterranean diet.
Amazing.
Like. Olive oil I love.
Yeah.
Great stuff.
So we actually... So people who actually don't like taking capsules are actually looking right now at a dropper form product as well. So definitely let us know if that's something you'll be interested in seeing sooner. Love to hear about that. But so 3 ingredients in this veggie capsule. So if I was to start taking this today, how soon should I expect to feel a difference?
Well, that's very interesting. We've relied very heavily on observational data from our people who've kindly reported to us. And it can be as quick as 2 days, and it can take 2 or 3 weeks before we get a response. We know in the laboratory how quickly the immune system is responded. We can see changes within 3 hours. But in the real life, it can take a day or 2. It depends really on the individual and what it is that's the problem as to how quickly. But generally, we reckon you should be taking it between 3 to 6 weeks on a stable basis before you can then decide as to whether it's had an effect or not.
Now, do you take this in replacement of a probiotic, or do you still need to take all of your...
No, I'm a great believer in holistic approaches. And I think that you need a good microbiome because that's the engine that will drive immy. Immy does not create the microbiome. It acts as the orchestrator, the broker, the modulator, the adjuvant. And it's the interface between your microbiome and your immune system. So you need to farm your microbiome. And the way to do that is to make sure you give it food, and that's prebiotics, and fiber is absolutely essential. In America, the level of fiber in people's diets is nonsense.
It's scary.
It's scary. It's 12 grams, which would freak me out.
Any doctor out.
Yeah. Well, yeah. And so you need at least 30 grams before we get interested. And the problem is if you put people onto the full-blown fiber with wheat bran or whatever it is, they ring you up and start abusing you because they get colic and wind and things because they're not used to it. So you need to build up, just like my baby hands. I was a surgeon. I got very soft hands. If I go and start gardening, I blister and bleed very quickly. But after a few weeks, I'm fine. So start on psyllium husk, which is known as Metamucil. It's very readily available. A dessert spoon, maybe twice a day with lots of liquid, and then build up to oat bran, and then you can go on to wheat bran if you want. So that's a given, right? And then you look at your diet and make sure that you get as varied a diet as you possibly can. So if you can try and eat between 10, 20, 30 vegetable types or fruits in a week, then I'm happy. And the more colored they are, the happier I am. And root vegetables are good. You want to put ginger for taste. You want to use honey. I like honey. I know some people don't like honey, but I love honey because it contains pollen and various other things that are useful particularly for kids. And if you want to have a glass of wine, that's great. You want to have some beer, that's great. Fermented food, kimchi, sauerkraut, I'm happy with all this. I don't want you to be taking ultra-processed food. Fast food that is designed to be preserved longer than is natural is a sort of general guide. Because, there's ultra-processed food, we sometimes do that in cooking, right?
Yeah.
And what I don't want is the response when I said to one chap, you got to eat more plant food. And he said, I do eat plant food. I said, what are you talking about? Look at you. He said, look, I eat plant food. I eat French fries. I eat crisps. I eat donuts. What's your problem, you see? So they think, well,
not the right kind of plant food.
No, get the right kind of plant.
They say eat the rainbow, kids.
Exactly right.
Eat the rainbow.
So we're actually going to talk about the Western diet in a future episode here coming up. But for those who are at home, we have thousands of people subscribed every single day who are taking immy and seeing the amazing benefits. But occasionally there's a sort of both sides of the equation. One, hey, I'm not really feeling so much right now. I've been taking this for 3-4 weeks, haven't really noticed anything. And then this other side that is, hey, I'm experiencing some gut pain in that. So would you say that's similar to this fiber piece on them? And then how would you?
I think so. First of all, I'd like to say that we welcome some of these, if you like, might be seen as negative responses, because it shows that we know what we're talking about, we're genuine, and this is a real entity. Nothing is 100%. And if it is 100%, then it's very suspicious, right? So, but having said that, people who get, there are two groups on there. One who say, look, I didn't feel anything. You say, well, okay, that's great, because hopefully you're in good shape and you don't need it acutely. But in the long term, you may well need it, because what we observed, particularly with the patients that we treated with this, was that they'd all say to us, and these were patients with terminal lung cancer, said, I've just been through the winter. All my relatives and family have had coughs and colds and spluttering. I haven't had any problem at all. Yeah. And then there were others who said, look, I went on to a trip and we ate some food and they all got diarrhea and vomiting, and I didn't. So there's that kind of prophylactic, preventative benefit. And that's in the relative short term. But in the long term, we think that it will prevent long-term chronic inflammation, which leads to, be it cancer, be it Alzheimer's, be it we won't know, because we have to follow people up for 20, 30 years. So that takes time, right? But when I tell you that 50% of the population will get cancer, 50% of us will get cancer. It's a frightening, scary thing. So why wouldn't you take something that might just help you? Okay, I think that's it. On the other side, the holistic approach for people who say, oh, I got some wind and pain. And I think they say, well, listen, you're precisely the person who needs to have this stuff. This is great. So, but what your problem is you've got the namby-pamby hands like me. You know, you need to toughen your gut up. You've got to get your diet sorted out. You've got to do a proper food, get some fiber on board, get a bit of exercise, you know, don't smoke, you know, stop taking weed and all those other things that you do. And then maybe things will be better, right? So, you know, I welcome criticism because I think, you know, that shows that we're doing the right thing.
Yeah, we want to have a real conversation.
Yeah.
Speaking of conversation, in this series, we're going to cover a huge range of topics, something as simple as your diet, your exercise, your lifestyle, all the way over to the gut-brain axis, to inflammation and chronic conditions. There's so much that we have to cover today, but we're anchoring all of that around immy specifically. And so I'd like to know more about immy and why it's unique. It's a great name for a very complex scientific name, right? It's Mycolici bacteria M. aurum aogashima.
Well done.
Lots of words. But I want to know what it means, and I want to know why it's unique.
Well, this particular version is unique, but Mycolici bacteria are they've only just recently been reclassified from mycobacteria. Mm. And the reason is that when people hear the term mycobacteria, particularly doctors, they freak out. And the reason they freak out is because the two most famous mycobacteria are tuberculosis and leprosy. Mm. And so the minute that, you know, there's this association that, oh my goodness, this is the problem. What are you doing taking this stuff, right? And there are people out there, by the way, I think have been trying to sell mycobacteria. And I get quite worried where they got these mycobacteria from. If you knew where they came from, you probably wouldn't take them. But Mycolici bacteria are a subgroup which are totally safe, totally non-toxic, and non-pathogenic to man. That's why they're in this bucket list, if you like, of Mycolici bacteria. So that's why it's called that. Why it's called aurum is because it's a gold color. It's a beautiful gold coloring culture, and the individual cells are gold color, which is nice. And then Aogashima is where this particular strain came from, which is the island of Aogashima. And if you have a minute, have a look up Aogashima in Japan. It's a beautiful archetypal volcanic island. It's really beautiful. And that's where it was isolated originally, and then brought to the West and all the rest of it.
Well, the Japanese are known for their longevity, so this is all pointing positive signs.
It may be something to do with it, yeah. And we've got a lot of mycobacteria. We've just discovered another 17 new species undescribed before, and we keep looking and finding them. So we collect mycobacteria, and I mean, if we had enough funds, we'd be investigating every single one of them. But right now, we're concentrating on the achievable, which is immy.
Very powerful.
Yeah,
perfect. Well, as we look to wrap up episode 1 here, just tell us a little bit about sort of the investment so far, the research that we've touched on across a number of different fields, of course, and just really what makes immy so special is that research that's behind. So let's hear a little bit more about that.
Well, the story begins many years ago when Professor John Stamford and Professor John Grange were trying to find an adjuvant for BCG, which is Bacille Calmette-Guerin, which is the vaccine for tuberculosis. And they were looking in sub-Saharan Africa in particular, because that's where the big problem is, but in other parts of the world. BCG, it works really well. It's not given routinely in the States, of course, but that's not a problem. But in Africa, it would be given, and the ideal is to give it under the age of 3. If you give it under the age of 3, it works really well. If you give it after the age of 3, it doesn't work very well. And so they found that the problem was they were trying to vaccinate adults and not getting good responses. So a natural experiment appeared, and this was near a place called Lake Kyogi in Uganda. And on the shores of Lake Kyogi were 11 villages, and 10 of the villages were cereal farmers, and the 11th village were cattle farmers. Mm. And the cereal farmers, they vaccinated the cereal farmers, rubbish. They vaccinated the cattle farmers, worked beautifully. And they're all part of the same people. There wasn't any sort of genetic differences. So they thought, hang on, what's going on, right? And what they realized was that the farmers set by their fields, the cattle people took their cattle to and from the lake twice a day to give them water, and they walked through the mud. So they cultured everything in the area, including the mud and hippopotamus poo and goodness knows what else was in there. Yeah. And the single thing that came up regularly was there's a mycolysibacterium called vaccae, after cow. In fact, it's more complicated than that, but we'll keep it simple. So they thought, wow, let's make a vaccine out of M. vaccae and let's give it to those other 10 villages and see what happens, which they did. And it worked. And so they wanted to try and expand this and things. And as usual, when you have boffins and brilliant scientists, they're not commercial agents. But one of the things, so they tried too much, and a lot of money was spent in research and clinical work, and they didn't understand the way the immunology worked. It wasn't just a simple adjuvant. You needed a bit more to it. They were lucky with what happened there. But one of the patients that they vaccinated was a woman with a big breast cancer. And they felt sorry for her because they thought, well, she's going to be dead in a few weeks. So they gave her the vaccine. And when they came back next year, she was still alive. So they thought, funny, something strange going on here. So again, it's this analogy that I've told you before. If you stand on top of the Empire State Building and you throw off 100 tennis balls and 3 of them float, you've got to explain it, right? Mm-hmm. So this was then triggered all the research. We then, they went into lung cancer trials, mesothelioma, also all with very promising results. But we didn't understand the way immunology works in cancer at that time. We're talking way back, 20, 30 years ago. And then I came on the scene and used a different organism because we couldn't have access to that to start with, called obuensi, another Japanese one. And before anybody accuses me of cultural appropriation, you don't have to have the Ugandan one. I mean, people have been in touch. So it's all over the planet. And so we did some work on obuensi. We had a phase 2 pancreatic cancer trial, which showed very exciting results, but we didn't really understand how it works. So then we moved on to aurum because we found that we were spending this amount of money, that it was going to take, probably by the time we finished, close to $1 billion to get us to a drug license for this, which is insane. Right. It's $2 billion for Big Pharma to get a new drug to market for cancer, and probably more now. And the cost was $150,000 for a course of treatment, say 6 injections. And I'm thinking, that's not what I did medicine for. It's not me. I will not make money out of the misery of my fellow man. I hate that. And so $1 a day, the Bill Gates's concept of sub-Saharan Africa, $1 a day, people can afford that. Mm-hmm. And oral, because then if you have to go and get it injected, that's more of a hassle. So anybody on the planet can benefit for $1 a day. And that's where aurum came from. We then started doing the research on that. Why did we turn it into a food supplement, a nutraceutical? Because, and why didn't we use the other two? First of all, aurum behaves better. We think it works better. But also, because these were developed as drug products, it's forbidden by the FDA and the European people from going into a nutraceutical or a food product. Mm. You can go the other way, but you can't go that way. It's not allowed. So if you see people selling you M. vaccae or M. obuensi or anything like that out there, that's illegal. It's not allowed. But aurum, we never ever developed it for pharmaceutical grade, and so therefore we have it. And do you know what? We found it's effective. So the research, and we've got ongoing research, 2 particular things. One was prophylaxis against type 1 diabetes. We've got the data for that, and it works very, very well. Amazing. Well, the second piece is we've done work on variation, if you like, on transcriptome studies in human myeloid cells, and we have that data is all coming through. We've got some data, we've got more data coming through. The problem is you need a massive supercomputer and AI to interpret the data. That's going to take 6 months. 60,000 data points on every single cell. 60,000 bits of information. Amazing. It is mind-boggling. Einstein couldn't cope with that, right? So we need the computers and things. So that's why it's very special.
Yeah.
You know, doctor, I feel like I'm echoing everyone's thoughts back home, but we really want to know who you are at this point. Who are you? And I asked you earlier, you said and you said you were an immunology dinosaur, and I'm not exactly sure what that means, but it sounds like you know an awful lot about the space.
Well, I think just dinosaur will probably do. Yeah.
No.
Well, I've been lucky, and I've lived through so many evolutions and iterations of what's happened in medicine over the last, 55, 60 years, right? I've been qualified since 1975, which is long time. And so I've seen the evolution of what happens. And my initial thing was that I trained at Guy's Hospital, which was the greatest teaching hospital in the world, in my humble opinion, now no more. And I went into surgery because I was interested particularly in transplantation. And my research, and I did a Master's of Surgery thesis on that, was based on trying to transplant pancreatic islets to cure diabetes. Again, shows how naive we were. We had no idea how immunogenic it was. But even at the time, we were thinking about trying to switch on the insulin gene in something that would be tolerated. And so I worked on all sorts of things, including the human amnion, which is part of the placenta. And, those papers still get quoted today. It's extraordinary. So I then went into surgery, and mainly general surgery, so another dinosaur, tuned into cancer surgery, but also was doing transplantation work with Professor Sir Roy Khan, people like that. These were the pioneers of liver transplantation at the time. Wow. Guy's was known for its kidney transplants. We did the first kidney transplants in the UK and in Europe. First one, of course, was done here in the United States on twins, identical twins. But we got on with it very soon after, and it was Roy Khan who did all that work and produced the material, the chemical that allowed immunosuppression to prevent rejection. That was Roy Khan's work, and sadly Roy died a couple of years ago. A great loss to medicine. Brilliant man. But anyway, so we stand on the shoulders of giants, right? And so I then was doing, that's why I have an interest in immunology, because of the transplantation work. I was then involved in the oncology, the cancer work, with bone marrow transplants and things, and putting in access ports and what have you. And it was obvious that if somebody had a cancer and you did a bone marrow transplant, sometimes the transplant would cure the cancer. This was more in skin cancers and things. But what was amazing, and that really stuck in my head, that sometimes a graft versus host reaction, which we did everything we could to try and prevent, was actually beneficial for the patient because it killed the cancer. Mm-hmm. And it showed, despite what all my colleagues were saying, that immunology was essential in cancer. So then the opportunity came up because one of my patients thought that I'd cured his cancer, not realizing that there's a higher authority that decides these things, but I did try. Mm-hmm. And he wanted to invest a lot of money. So I went up to a major teaching university, I won't dignify it with its name, and the professor of oncology there, I remember him saying to me, "Do you know what?" He said, why are you here? I said, I've got a lot of money. I've got $15 million that I can give you for it. Oh, thank you very much. Please sit down. So yeah, but there's a catch. I want you to look into the immunology of cancer. And I swear, that man said, professor of oncology in 2007, which is not that long ago, what has immunology got to do with cancer?
Well,
and I thought, do you know what? I'm going to do this myself. So then I set this up and started doing all this work into it, because it was about time that I was due to retire from active surgery. I was getting old. And so I turned into immunology.
But, now that you're in immunology, you're choosing to spend your time on IMMY, and I think it's incredibly important. Like, what is your personal reason? You must have plenty of you've done as many things as possible in the medical field. What is your reason? What is your why for IMMY?
Well, the truth of the matter is that once I started working on IMMY, we needed to have a victim, if you like, to test the drug on. As with all new unknown things, it wasn't actually immy, it was its precursor, obuensi. And nobody in the world had been injected willingly or knowingly with obuensi. So I had the first injection because my view was that if I couldn't take it, why would I give it to anybody else, right?
Yeah, OG biohacker.
Yeah, okay, the original biohacker. So I had the first shot and I survived, so that was great. So I thought, well, we need somebody to have the second shot. And I think I've told you the story. My son at that time, who was, some years before, when he was 17, 12 years before that, he was 17 years old. I sent him out to Africa to do a gap year school between school and university. And the poor boy, big, strapping, 6'1", very, proper six packs and all the rest of it. And he picked up infection with the African Epstein-Barr virus, which is glandular fever, and a parasite called toxoplasma, which again is well known. Most people get toxoplasmosis. They don't even know they've had it. A lot of people have it. You might have it for all we know. You wouldn't know unless you did the test. But every now and then it causes a nasty reaction and big glands. And he came back with these huge glands. One was biopsied, and they diagnosed a lymphoma, which is a cancer.
Wow.
With the lymph glands. I thought, no, there's something wrong. This is not right. And so I then did the EB virus and the toxoplasma, and they were completely off the scale. So I said, right, that's the diagnosis. So he was in bed, and he was melting away in front of my eyes. And he was in bed for 12 years.
12 years.
12 years. I took him round to every single colleague, doctor that I knew who was supposed to know what they were talking about. And we got nowhere. There was nothing that could be done for this poor boy. And he had the classic super version of post-viral syndrome. Couldn't get out of bed, melted away, had no appetite, just sat there. And so I thought, he'll do. So I injected him. And my wife agreed it was all right. And he agreed.
Okay.
And 24 hours, 48 hours, he suddenly woke up and he said, gosh, he said, Dad, what did you do? I said, it's just a straightforward little shot. He said, but I feel completely different. I'm hungry. I'm awake. I want to get out of bed. What did you do?
Things that weren't common for him?
Nothing for him, yeah. And so sure enough, he got up moving, eating, drinking, all the rest of it. And that lasted about 6 weeks. So I thought, do you know what? What we learned was that this was not a vaccination, even for cancer, that giving one dose was not appropriate. You have to keep giving the stuff in the same way you have to keep taking the immy by mouth because you poop it out. The effect only lasts by injection for about 3 to 6 weeks, something like that. So gave him another shot. I gave him another boost and another one, and did that over a year. And at the end of the year, there was my boy back again.
Incredible.
And I thought, and I still do, I think if I achieve very little in my life, that I cured my son. And I'm very grateful to immy and its like for allowing me to do that.
It's really powerful. I'm excited to pay that story forward and help other people as well.
If only we could, and I pray that they will have the same benefit. It's worth it.
Amazing. So we're running short on time. I think we can finish with some rapid fire questions. Do you have some for us, Alex?
Yeah, absolutely. So how long until I see or feel an effect?
Well, as I mentioned earlier, probably some people within 2 days, some people it takes 3 to 6 weeks. Those are the range. You really need to take it for at least 6 weeks before you can say the stuff's not working.
Okay, so what should I be aware of if I don't notice anything?
It's about as dangerous and harmful as yogurt. It's not going to do you any harm. We have had the occasional, complaint that it caused some wind and colic and gripe, and that's probably because that person needed it more than he thought. He needed to amend his diet and train himself up. Others say, well, I don't feel anything. The answer is you probably didn't need it. However, in the long term, if you want to make sure you're protected and you have what's called bystander immunity from infection and colds and coughs and cold sores and all these other things, might be an idea to stay on it.
Yeah. We're going to talk a lot more about the different things and effects in those future episodes. Can it be combined with other vitamins and supplements?
Sure. It's like food, you know. I mean, if you can take a teaspoon of honey with something else, it's totally harmless. We have no evidence that it interacts with anything badly.
Well, and it's found in the soil. So, I mean, ultimately, if you play outside, it's just like...
You probably chew a bit more. You know, yeah.
The orangutan leaves.
Yeah, exactly. Yeah.
Is there anything I could be taking today that this could potentially replace?
Well, that's a question we always say, particularly in the supplement and novel food area, or even though I'm a doctor and a clinician, we have to be very careful with the claims we make in clinical terms. And so everything really should be discussed with your doctor if you are replacing a conventional medication. So don't just go and stop your steroids or whatever else you're on. Make sure you talk to your doctor. He'll probably say it's a load of rubbish, and that's fine. Just don't take any risk that you may regret. We don't think it has any interaction, anything bad. We think it replaces potentially patients who need immune support at an intermediate level. It's not going to stop you rejecting your kidney or, if you've got severe rheumatoid arthritis or whatever it is, it's not going to necessarily replace that. If you've got ulcerative colitis, fecal transplant, in addition to it, may well be miraculous. But that's a different story and to be discussed with your doctor. Don't be stupid.
So we're looking forward to getting into some key topics, obviously, in the next few episodes. We've got the gut-brain axes, diet, lifestyle. We're going to talk about sleep. We're going to talk about anxiety. And we're also going to touch on longevity and those big diseases. So the cancers, dementias, and those others. So looking forward to tuning in those future episodes.
Make sure to follow, subscribe wherever you're tuning in. That's it for episode 1. We'll see you at the next one.
Thank you very much, Elaine.
Thank you.
Well done.